Broadcasting way too early from three separate Wi-Fi connections. It's PT Breakfast Club with Tony Maritato, Dave Kittle, and Jimmy McKay.
Good Thursday morning to you all. Welcome back to PT Breakfast Club, the only healthcare show that's a must listen before you accidentally hand your patient data to a chatbot. You could easily do that. You could accidentally do that before 8:30 in the morning. Today, this is called the front tease guide. We're going to front tease forward. Let them know. This is like when you do a short form video and you're like, wait for it. AI just got access to your patient's health data. That's either great or horrible or horribly great. I'm not sure yet. Medicare gave you a pay bump. That's actually a subtraction, addition by subtraction. We talked about that a little bit yesterday, but I feel like we all have it on the docket for today. And I wanted to talk about Gold's Gym. Gold's Gym in my area is doing something. I don't even think it's what they're doing nationally, but I think it's important what they're doing. And they're doing it in plain sight. And healthcare, in my opinion, will look at it and be like, oh, that doesn't apply to us. But it 1,000% should apply to us, but most of us will ignore it. So let's dig in. We have to go first to a sponsor. We got a sponsor. No, that's the wrong sponsor. There we go. Hot Pack Express. Today's show is sponsored by Hot Pack Express, the leading provider of fast, forgettable modalities that satisfy the 8-minute rule and your deepest apathy. Why stretch when you can just bake a shoulder at 145 degrees for 12 minutes? Comes bundled with a stopwatch, a foam cervical roll, and a false sense of productivity. HotPackExpress.com, keeping PTs licensed since 1976. Hot Pack Express. What would you do, Tony, if that's what your hydroculator looked like in your clinic? It's just... By the way, I called it a hydrocollator for the first year and a half of me in PT school. No one corrected me. I'm like, also, you don't say it a lot. You're just like, bring me a hot pack. But I was like, it says it on the side, hydrocollator. I don't know what the hell it is.
I still love the condescending PTs that want to make fun of their patients for wanting hot packs, wanting ultrasound, wanting things that feel good when they're coming to you to feel better.
Oh, man. We'll get into other stuff, too. We got somebody debating me or not debating me, arguing with me in LinkedIn comments. Remind me to bring that up later. But
really quick, I got some new swag. We got some new shirts in. We got new. I gotta ask you guys live. How does the font look? Can you see it? Can you see the concierge pain relief? The new gray fitted. How you doing?
It looks good.
How you doing?
The you asking if you like the font reminds me of Patrick Bateman in American Psycho, where they all just keep like showing each other their business cards, like, ooh, look at that. What color is that? It's like, that's bone. That's bone there. And look at that font. Sans serif, or is it pro with serif?
Something like that.
Yeah.
Good.
It looks good, Dave. It looks good.
And then, Dave, remind me, I rolled out a small marketing campaign for you. We'll get into that. I still think the lead story is OpenAI. OpenAI just launched ChatGPT Health, a version of ChatGPT that connects to patients' health records, Apple Health, insurance information, and more. The funny part is we're sitting here 2 days ago talking about like, hey, it'd be great if these EMRs could like do stuff and connect to stuff. And OpenAI was like, hold my beer. And you knew they were already doing this. The funny part is I believe we also mentioned, or maybe I just said this in my head, like whoever does this first is going to win. Like when you bring the walls down and make it more open access, more people will lean into it. So how much research, this just happened yesterday. How much did you guys even look into this so far?
I haven't seen any of it. I will say Google had Google Health, Google had an EMR, Google had stuff a decade ago, but the compliance and the regulation and the burden of bureaucracy just completely crushed it. I don't know. Yeah, we'll see what happens. Google canceled their EMR. I mean, who could have built a better EMR than Google? Look at what they did with Docs and Sheets.
Here it is on the screen. Live stream. I'll just put it on there. I'll just scroll around. Go ahead, Dave.
Yeah, so I just watched this like intro video that you sent us, I guess earlier this morning or last night. My thought was it's giving different patient accounts of like, hey, ChatGPT, I have 10 minutes in between my babies that are napping. Give me a 10-minute workout that I can do based off of I only have access to 10-pound dumbbells. And then there was like another woman, it was like, I'm having an endometriosis flare and XYZ, like asking for like some assistance or whatever. There was another guy. I mean, there was like these cases of like using ChatGPT for assistance. Oh, the guy was taking pictures of his food before and after the food, and it was giving him like the calories and like an inflammation score. I mean, there was some good, there was some like cringy bad stuff. Like I think people, at least in the US, I think they're going to use ChatGPT not all that different than how they're already using Google. They're looking for information. But in terms of like executing a plan, yes, you can use ChatGPT to build a plan. I told you guys before, like writing up plans and sending them to prospective patients before ever meeting them, just based off of the intake phone call. So yes, it can give you some high level of a plan, health and wellness plan, health, action plan. It could be a good thing in terms of helping some folks be more empowered to take control of their health. That's awesome. I'm sure, like, I know you guys all, who wouldn't agree with that or who wouldn't think that's a great thing. But there were some other things of like, why is this guy building some, models for himself where he's talking about like an inflammation score, so everything that you eat is like causing inflammation. So there's just, I don't know. I don't know if it was just the video and the framing of it. But at the end of the day, I think it's a net positive that I think it'll empower some folks to do more of their own health and wellness focus, and maybe ChatGPT can help leverage.
Yeah. This came on the heels of, there's always statistics flying around, but like there were 250 million health related ChatGPT questions like a week. Or if you had told me a day, I would be like, yeah, okay, that tracks. I mean, I do it a lot in and outside of like, MSK realms. It's made me a really good cook so far, because I'm like, how do I not screw this up again? Because you know what I do? I'll open the box or the bag, put the food in the air fryer, then I'll have to go back to the garbage to pull the bag out to then read the instructions. I don't know why they don't. There's got to be some better way. But this is inevitable. This is just removing one barrier of friction. Now they're saying it out loud. Like people knew that they were doing this already. They're a search engine with AI in it. They know what people are searching for, right? I mean, this is Answer the Public on steroids.
I had shared a post a couple of days ago where I was saying I think there's a real legit opportunity for us to create, whether it's a custom GPT or an individual basis, because ChatGPT is not HIPAA compliant.
Right.
I get a new patient in the clinic. We're sitting there, we're talking. They're, tech savvy. They understand. They're using, like me, ChatGPT every single day. They understand how it works. I think the sweet spot right now, this minute, is patients don't know how to ask the right questions and how to dig deeper. Yep. We can help with that. So if we create a 20 questions kind of thing to guide the patient down the road in the chat, and then they use the chat as a journal. So I woke up today. This is how my shoulder feels. This is what I did. When I did that, it got worse. When I did this, it actually felt a little better. The chat is creating this log like a journal, interpreting those results. And then if I see the patient next week, they come in, they say, hey, give me a summary of all the information, analyze the information I shared. It communicates to me, the therapist, in 20 seconds, what might take the patient 20 minutes. You could do this with doctors. You could do it with so many other situations, but the chat has to understand the questions to ask. And I don't think it's there yet. That's why people get bad information, because they don't ask the right questions. Yeah,
it'll get there though, because you could also ask it a good dumb question. Do you understand what I'm saying? Like you could be like, my back hurts. You don't have to say like, I've got soreness 3 inches above my SI joint. You could be like, my back hurts. And then like good AI would be like, well, where is it? Let's help figure out where that is, since I can't see. I decided to train my Misogi for the year, which is like my BHAG, is I want to do another triathlon. I'm going to do another Ironman triathlon. So I've got just a GPT. I've told it all the data about me, height, weight, my experience. And now when I ride Peloton, I don't even download the data. I screenshot it and I go, here's my ride today, analyze it, adjust my training plan accordingly for the next couple of days. If I had if I have sleep data, I do the same thing. If I had an Oura ring, I would be doing that. But yes, this is something that is able to read and recognize. This is not a stay in the pocket quarterback. ChatGPT Health, read and recognize. Ben Galen said, it's 230 million users. Not searches, users asking about health each week. You could have told me 500 million and I wouldn't have been shocked. Wouldn't have been shocked. I would be like, yeah, that tracks. And look, that's right now. That's right now. Like, there's still people that I know that are very smart or like, I'll get to the AI. I really don't know what I'm doing. And I'm like, I feel like spending 20 minutes a day might be a good investment. Where's this go? What's the next O expletive moment? Like, this is pretty O expletive. It is and it isn't. They've said that now that they're actually saying it, like, that to me is they're going to start leaning in. There's going to be different integrations in my mind. Where's this go next? What's the next O moment?
I think the lowest hanging fruit, like the easiest, is wipes out all the simple musculoskeletal referrals going to physical therapy. Completely puts them all, into the AI world.
It won't.
It absolutely will. I mean, it's a step up. It's a smart YouTube. I have a shoulder problem. I go to YouTube. I look for answers. Now it's a smart version of YouTube. And if it means paying $50 to go see Dave, an amazing therapist, because that's my copay, versus a 5-minute chat search, I'm going to do the chat search. We just did this with, we're dog sitting. We're dog sitting for 5 months. The dog's eating super healthy food, but he's got some skin stuff going on, and he's got horrendous sulfur. Like, I feel like I'm living in a volcano gas. And we're using ChatGPT to analyze his diet and why is he stink so bad and what's going on and why is he chewing and what. And it gave us the most amazing like breakdown of dogs being sensitive to chicken. And even though we were doing a really, really high quality Blue Buffalo food, the chicken sensitivity is a common problem. He's not digesting the protein. That's why you smell the sulfur in the gas. So switch to a single ingredient if you have the money for it. Do a prescription single ingredient. If you want to be a little more economical, go to, these recommendations. This is how you switch from what he's been eating to what he's going to eat. This is the switching cadence. And it's amazing, and like, I would have gone to a vet if I had not had access to this. I believe it more. I trust it more. It provides me the citations that I want if I ask for them. This will absolutely replace most of what we do on a typical outpatient level.
Do you think Sam Altman was sitting there a couple years ago going, someone somewhere eventually is going to be typing in, why do my dog's farts smell? And they're going to get great answers. They're going to get great answers, and it's modify the chicken. I will say this, and I want to make sure we understand background before I'll come to you in a second, Dave. This is how they're explaining where they get this information. So OpenAI is saying that ChatGPT Health, this specialized AI model, was in collaboration with over 260 physicians who helped shape the responses for safety, clarity, and appropriate care escalation, and developed a unique elevation tool called Health Bench to test it. So, and they say they've been working on it for 2+ years. So this wasn't like, hey, let's aim this crazy thing at health now. I'm not saying it's perfect. Nothing is. That is how they're explaining their where the runway came. So this was not overnight. This was, according to them, for 2 years.
So I could see, Tony, how this could help. I could see how maybe right now there's a bunch of people that are already like, hold on, wouldn't already those folks, Tony, be using YouTube to do these, regular exercises and all the exercises that physical therapists put out, and maybe some personal trainers that they put out? So, but like you're saying, this will wipe out those cases that are like easy musculoskeletal cases that are going to physical therapy. Like, a video-based platform is not already helping that. Like, they type it in, and this I think, what you just described with the dog sitting and you're troubleshooting all that, you don't realize it. You're like at the top echelon of like users who will use this type of a tool. What you're describing.
I agree with Dave. I know what he was saying. And he's right. Like, yes, we are, in the top 1% of users, most likely. In fact, I think when I looked at my year in review, it basically told me I was like in the top 3% of users and whatever they were measuring. So Dave's right. Dave, once again, Dave is right.
But I think what you're saying is it's going to weed out some of the bottom. Like hopefully the things that are coming there are still really appropriate. Like they're good, they're quality, and they're hopefully the ones that will follow through and find value. I don't want to say follow through, but like see the value, believe the value, follow through on the value, get the value.
Yeah, right. Dave, I was saying you're right.
And I don't know if there's a lag. We got a lag here?
No, you're good now.
You're good. I was saying you're right.
Well, I'm just saying.
And Jeremy Sutton says, hey, when Dave gets on a roll, Tony cuts his feed. It does look like that. It's like, it feels like that show, that the one they just canceled on ESPN where Tony Real used to be able to mute people, muted for 30s, -3 points. We should do that. We could do around the horn. Listen, this was coming. This is the Internet of Things plus AI now. And I don't know, it feels more useful. Will it take over the world? No, probably not. Will it do nothing? Absolutely not. It's going to be doing something. And if you're not paying attention, you're going to get run over by this. And I just want you paying attention. You don't need to get a PhD in GPT. Hi-yo. You do need to be paying attention to it and understanding those things. This is why you watch the news, right? I didn't understand that when I was 11. I was like, why do we care what's happening in wherever? It's like, well, butterfly effect, ripples, and it's just good to be smart. I don't know. I think AI is a filter. It's a tool. We can point these things, right? Like I still get caught though halfway through my day, like doing things manually. And I'm like, oh, what am I doing? Like I'm still in my pattern. And then I'm like, there. I have a second monitor. I'm like, that's all I put. That's ChatGPT and AI is only on that monitor. And I'm like, okay, so it's almost like a second computer. Visually, it's a second thing. And I catch myself 4 or 5 times a day not doing things the easier way or the more effective way, and that seems, I don't know, stupid for me. Has anybody brought up in clinic with you, and when Dave comes back, I'll ask him the same thing, and this is for the audience as well. This would be a great question. I asked ChatGPT and it said this. That's had to have come up already. Really? No?
I don't think it has. I don't think it has. But I haven't heard. I don't think it has.
Yeah, Ben Galen saying that's population health. Low complexity, low acuity, don't need the full experience. Right. We sort of want that tree. That's what triage is for. It's why not everybody gets a bed in the ER. But for decades, PT only offers the full experience. Yeah, there's no PT light. Right. This is where like PT and the ED is all like everybody's like, that's ridiculous. I'm like, is it though? Isn't that the greatest place for it? Yeah. Oh, he even said that. I didn't know. PT Lite, AL will be PT Lite and solve a lot of issues in access and cost. How great would that be if you're like, yeah? How many times have you seen someone you're like, you don't even need me, man? Look, do these 2 things, and you're gonna feel great. And you're like, those are the people who are like, come on, give me 20. I'll give you $20. You're like, no, man, it's not even worth it. It's not a real solution.
And you know, this is where we go back to. I think we lose contact with a huge demographic simply because we're not willing to offer PT Lite. I used to offer the 20-minute sessions for 20 years. I used to offer lunch break PT, like just come in and out 20 minutes. You will absolutely not even miss your lunch break from work. There are so many people, one-time sessions, one visit plan of care. Like I have no problem evaluating someone and just telling them, hey, you're doing great. Peace of mind. You're good. Just keep doing what you're doing. Yeah. But, so many of us don't want to do that. We don't want to offer that.
Is it because the onboarding and the getting them set up and in the door, the juice isn't worth the squeeze, right? It's like so much effort. Yeah.
Yeah, I think that's a big part of it. And it's a lot of it's self-imposed. Like I still go back to when I was teaching my Medicare course. I'm like, are you guys asking all referrals the same questions, the same number of questions? Because you know what? If somebody's coming to me for 1 to 3 visit episode of care, I am not going through 9 million past medical history questions. That's only if I expect this person to be around for 12 months. Yeah. If it's a simple case, insidious onset, you woke up with a kink in your neck, I don't care about your injury 37 years ago. We're just going to deal with the kink in your neck. But like therapists refuse to accept that. Going back to the stuff I see on TikTok where a guy, great therapist, I'm not denigrating, I don't know if that's the word, But he was like, yeah, I go through a 57-point checklist for an upper quarter screen. I'm like, why? I just asked you to pick something up. Let me see you pull this. Let me see you push that. Let me see you touch the top of your head and the low back. Okay, I got enough information. Let's just start doing stuff now.
I was going to share this in the Facebook group, but it felt a little sexual. So I don't want to go edgy. It's not that sexual. But like this is a great example. I don't know what a photo shoot would be for someone, an hour, 2 hours. This is going to shock you, Tony. I've never had professional photos taken of me. But this person is a photographer. They're offering, first of all, font choices, script, handwritten font, horrible idea, but keep going. It says, hello, Valentine's Day Boudoir, 20 to 25 minute session, and you get 10 edited images and 1 mini Polaroid. I'm guessing that means like a physical, you get 10 like JPEGs and a tangible thing. $350. Like I'm sure this photographer is like, yeah, I've got a session that's like 2 hours and you're going to get 1,000 pictures or whatever. But they're also like, hey, if you just want to bang this out in 20 minutes, let's do that for Valentine's Day. So I wasn't going to share that because it was like, it's a little racy. But I'm like, is it though? It's someone in their underpants. I've walked in the mall, look at that. There's a Victoria's Secret. But like, that's an example of like PT Light. Like, does everything have to be the full Monty? See what I'm doing there? No, it doesn't. You can offer I could develop a full advertising campaign for you. We could shoot videos and whatever images. But I've also got this session where, did you see what I did with Bo Babenko?
Yeah.
Dr. Bo. So yeah. Bo sat on StreamYard, the app we're doing now. I looked up his website, Bo, and I know Bo already. And then I sat down with Bo and he sat there with me and I asked him 20 questions, all in alignment for his strategic goals. And then I zhuzhed up the videos and said, here you go, Bo. There's the next couple weeks worth of, your Instagram content. Bo showed up and it was Bo. But if I had said, Bo, I'm going to fly there. I'm going to bring in 3 videographers and whoever the person is that holds the light and angles it. And we're going to do this. It's going to be 10 grand. And he would get a lot more, but he's like, I don't need too much. You're trying to kill a fly with a hammer. So you have to, I don't know, scale appropriate. So I've got different options. Which one's appropriate? I don't know what your problem is yet. That's where I think what ChatGPT Health is going to knock out a lot of those that were never meant to be there anyway. I think this is net positive.
And I would say, like all things, we can have a place, we can have a seat at that table. So we market, we explain to the population, we're like, hey, this is an amazing resource, PT, Chat Health, whatever. Go here, do this, ask these questions. We create video content showing the consumer how to use that tool. And then if the consumer doesn't get what they need, guess who's going to be the first person they're going to choose to go to for that real life interaction? That becomes us. But like, if we completely ignore it, completely move away from it, say how terrible it is, it's not going to do anything. We don't have a seat at the table anymore. We just gave up that opportunity to some other profession, some other professional.
Yep. If you avoid it, pretend it doesn't exist and be like, oh my gosh, I don't want anybody to know about this at all. Then you're going to get run over by it. I believe Dave's on the phone.
Good morning. Sorry for the tech issues.
There you go. All right. Now we got you on the phone. On the phone, Dave Kittle.
First time caller, long time listener.
Long time co-host, first time caller.
So final questions before we move on from this topic. Just final, not parting shot, but medium shot. Do you guys think this creates more informed patients or more confused ones? You have to answer more informed or more confused. Dave, we'll go with you first. More informed or more confused ChatGPT Health?
I think they can be more informed, definitely.
Yeah.
More informed. Yeah.
More informed. And then the final one before we move on. What's one way a smart clinic can ride this wave instead of getting run over by it? That's going to happen. Standing still with your back at the wave, you get killed. What's one way, simple way?
I'll go first, Dave. You missed it, but I was just saying what we should be doing is creating content, teaching consumers how to use these tools to get their answers, because when they don't get the answer, then they're going to come to us for the more detailed, more in-depth response.
Yes.
I absolutely love that. I can't even think of anything remotely close to being even in that
Teach 'em.
ballpark, that I agree 100% with, because if they don't find the answers in that pathway, then they will look at someone like Tony or I or some other practice and say, you know what, this, they sound like a consummate professional. Let me contact them, because I was not able to get my solution or I wasn't able to figure it out with ChatGPT. So at the end of, our content or videos or whatever, there could be that call to action that says like, hey, if you're not finding what you're looking for with ChatGPT, if it's not resolving your situation, not providing a customized enough plan for you, go ahead and reach out.
And then the only experience, the taste in their mouth of you is, there's that guy that's super helpful all the time. And yeah, I can't figure this damn thing out. Same thing as the plumber who's like going to teach you how to fix basic stuff that he's like, it's going to be a pain in the ass anyway to come out there and fix that basic thing. I want the $10,000 job. I don't want the $1,010 jobs. I don't. Maybe someone does, right? Someone does. It's not me.
Hey, so real quick, before we go to the next one, Dave is the consummate entrepreneur, problem solver. I love what he did. I did this yesterday. So yesterday, I was a third-party observer in a physical therapy session with a patient. Therapist reached out, friend of the pod, he's probably watching right now, asked me for some input on a situation for a patient. We did the video consult, and then we kept getting like frozen and stuck. And I was like, hey, let's just kill the video. I saw what I need to see. Let's go to a voice call so we don't have an interruption. And it was just spur of the moment. Dave did exactly that. He's like, I see a problem. I'm going to come up with a solution. And now he's with us. I love it.
Yep. Agreed. Want to make sure we pay the bills. Today's episode brought to you by the Compliance Candle. A lot of candles going around in PT. Maybe a lot of feng shuiing, but the Compliance Candle, the only aromatherapy designed for clinics teetering on the edge of a Medicare audit. Scents include, did you bill that? Where's that plan of care? And our bestseller, you forgot the modifier again. Hand poured by overworked staff during their lunch break. Thecompliancecandle.com. Burn one before you burn out. That's a great tagline. Burn one before you burn out. And just before we move on, I'm already securing the social media handles for the ChatG capital PT. That'll be me. I'll be the guy who explains everything. So follow me on Instagram, unless someone's already grabbed it, for the ChatGPT. That is me. Second topic today. We'll move to this one. We a little bit flirted with this on Tuesday. And I could find the graphic that you shared, Tony, but Dave wasn't here. Every major CPT code went up slightly. Yay! But down in real dollars when inflation adjusted. Wah, wah. So 97110 went from $27.56 to, buckle up, kids, $28.01. But keep in mind, we don't have pennies anymore, so we just round down anyway. But now it's only worth now it's only worth $27.25. So we're net down a quarter. This is why I wanted to bring it up again. We can deep dive into the numbers. I'm gonna zone out after about 11 seconds anyway. I'm just gonna nod. I'm gonna believe what both of you say. But what are we gonna do about it? So it's what, so what, now what? And we've talked about this before, and I feel like people are catching on. Someone like Drew Cruz was like, wait a minute, are you saying we could use insurance as a loss leader? And maybe we need to explain what loss leaders are, not because we're talking down to people, but because it's not a normal healthcare term, especially in PT, which is if we lose money on the hot dog at Costco, but you come and you're in the building, and we know for every 100 people that walk in the front door, they spend this much money. Our job is actually get more people in the door. And then also, how do we make buying seamless? This is a process and a pipeline. So how do you do that in MSK care? We'll go brick and mortar, and we'll go Dave concierge. How can people understand this concept, and how do they do it better?
Well, I don't participate in these low-paying insurance contracts. Right. And I think
you shouldn't.
Tony might have better ideas on how to potentially use these in-network contracts as loss leaders to get people in, and then funnel them to what he has as, I forget what he calls it, but like the weekly or monthly membership, or like the continuity program. The challenge I believe, is that I mean, it's just a numbers game. Like, it depends on, like, I don't know how great the practice is and how well they frame it and describe it, and the spacing that they have for these members to kind of go from insurance-based physical therapy to some continuity or out-of-pocket services. When people come into an in-network world and they just want to pay their $20 to $50 copay per visit, I think it's really challenging. And I would love to hear rebuttals. I would love to hear anyone that watches the show, send us a message, comment below, message us or comment somewhere on one of our YouTube. But let us know, like, are there practices out there that are in network on the front end and then have, like, the whole process dialed in to convert people from like a 6 to 12 visit plan of care through their in-network insurance to a continuity membership or some self-pay per visit member or self-pay experience where they're paying $100 or $200 per visit. I just don't think it's possible because I believe it's two different customers. It's two different consumers.
Well,
and that's the challenge.
So stop advertising for those customers, right? I mean, you get what you attract, or you attract what you attract, or
I agree with Dave. It's there needs to be a new model. There needs to be a business started from the beginning where the seed planted for the business is, okay, we're going to use insurance to bring people in. Here's the thing. So on what Dave is saying, it's like, okay, McDonald's sells a cheap Happy Meal. They're never going to convert the customer buying the $4 Happy Meal into somebody who's going to pay $80 for a dry aged steak, right? So, like, there's no reason to even try that. The thing is, you're not going to get somebody who doesn't want to pay for your service to all of a sudden want to pay for your service. But wealthy individuals who do see the value in something premium, they also have insurance. So the messaging can't be like, my messaging is, anyone, anywhere, come into my clinic. We're going to take care of you. My messaging is not, hey, we have a premium level service. We have premium equipment. We have the best everything in town. And if you have insurance, you want to use it, come and we'll start with that. Like, that is a different business model, but I think that's the business model of the future. That's where the combination of what Dave does and what I do comes together is, okay, who are the executives in my town? So we have a couple publicly traded companies. Who are the executives? What's their insurance? What is the plan? Now I'm going to start creating marketing content focused on individuals with that specific insurance plan. And I'm going to deliver a premium service so that they're coming in on the insurance, but then they're going to stay for the self-pay stuff.
Yep.
That's where I think it needs to go.
Yeah, I just hear that song. My insurance brings all the boys to the yard and their life is better. It's going to bring them to the door, but if you consistently bring the wrong person to the door and that's not the person that's ever going to convert here. And I know people are like, these guys are icky. They're using words like convert and upsell. And I look at it as like, because I know there are people with a deep affliction of the Peace Corps gene. I have a little bit. It's not deep, but it's in there. I promise. I have a heart. Who are going to say, but then you can't give this to everybody, therefore you should give it to nobody. And I'm like, that doesn't feel right. That I feel like there's some logical fallacies. The funny part is I've had conversations with these people on LinkedIn the entire time. I've had like a chart of logical fallacies out. And I'm like, oh, because what they're saying sounds right. And I'm like, no, it's a logical fallacy. Once I learned about what logical fallacies were, I was like, oh, this is how people can sound right, but it doesn't hold water. So like, you offering a more premium thing does not diminish the thing someone else can't get. I'm very sorry. I'm into raising the floor and the ceiling, but you can't get mad at me for doing either of those things. But for some reason, people in our profession get very mad at it. I can't believe you're offering cold plunge and charging money for it. I'm like, well, you don't have to get in the tub. I'm not getting in the tub, by the way. So that's the way I sort of look at it. I did a little prep, but 10 ways you could use. I'm sure we could do an entire we should do a 6-pack episode on this. 10 ways that you can use insurance as a loss leader, but what are the other things? And one is like gym membership or upsells or premiums.
Well, just real quick, I want to hear Dave's perspective because he and we've never really talked in this direction. So Dave, you have insurance, I'm sure. You know executives and wealthy individuals that have insurance. I think the key is targeting the marketing to that individual with insurance and high net worth, who then would be on board switching from, okay, we're finished with what insurance will pay. Now I'm going to self-pay. Does that sound right?
So I agree with that. I mean, I've even considered like where we take out of network insurance, which we do, and we have a medical biller to facilitate that. And then after that patient comes in and experiences therapy with one of our therapists for X amount of time, then we eventually potentially would have said, hey, we're no longer going to be billing your insurance. We'll provide you with a super bill, and here's why we're doing it, and provide, some ChatGPT canned response of like patient experience or efficiency or whatever. And then eventually just segue them to like paying out of pocket and giving them some super bill receipt for their reimbursement consideration. I've definitely thought about that, where we definitely do capture more people that we bill through their out-of-network insurance, and then later it's basically like they've become our ideal client. But in the beginning, they are a little bit. Some of them, even if they're well off, are a little bit more insurance minded, and that is the challenge. I think that's a lot more doable for me as opposed to going from like the in-network to self-pay. I think the out-of-network insurance is easier because, let's say now we're in January, so a lot of these pretty much all the out-of-network deductibles, typically 97% of them are resetting or have reset on January 1st. So now the beneficiary has to hit even their out-of-network deductible to then have their insurance kick in and pay. So they're going to pay us out of pocket, or they're going to pay some other, physician or the MRI or whatever. They're going to pay out of pocket, $500, $1,000, $2,000, whatever dollars, sometimes way more, sometimes, $4,000 or $5,000, or even more than that. And then it gets covered by their out-of-network insurances, right? So then at that point, they're already kind of like semi-self-pay or out-of-pocket in some ways, as opposed to going from in-network to ripping the Band-Aid off, and it's just a bigger gap that way.
Well, all right. So Stephen Dunn chiming in here. I'll read it to you, Dave. When he was in cash only, it was easy to move people over to our Pilates program. I'll say that again. Stephen Dunn says, when I was cash only, it was easy to move people over to our Pilates program. That friction tracks. Yeah. I'm paying money, and now I'm going to pay money for this other thing. It's all money. It's just, it feels like paper money or invisible money. But with MC, is that managed care? Is that MC?
Medicare.
Oh, Medicare. With Medicare, they never want to pay for wellness services as they are used to paying for nothing. Yes, they're used to. I agree with Stephen, 100%. They're used to it already being paid for, and I'm using air quotes. If it's already paid for, why am I paying? You're trying to get more money on me. It's not. That's not. This is a communications problem. Do you see what I mean? Because I feel the same way, right? If there was money coming out of my check every month for auto repair insurance, and then all of a sudden I had to pay more, I'd be like, whoa. I look every 2 weeks and I see that thing. It says minus $275. I thought this was free. I thought, no, not free. Sorry. I thought I already paid for it. Well, you paid for auto insurance, not auto repair. There's the difference there. So yes, this is psychology. This is psychology with communications.
This is where Tony needs to jump back in, because he's posted this a lot over the previous years, including the past year or two, where he'll say things like Medicare covers the bare minimum, and it's kind of like it is what it is. But every other practice is, billing Medicare as if it's like the complete panacea of everything for all people, for all physical therapy, right, Tony?
Yeah, 100%. And this goes back to, we are so desperate to deliver an exceptional service. We want to wow every single patient. We want every single patient to be as passionate about therapy as we are. We are willing to take the food, literally the drumstick, out of our kids' mouths and give it to somebody else, because we are so desperate for that approval and that acclamation that, we're like, well, the CPT code covers therapeutic. The one I always use is CPT code covers gait training. Well, gait training could be a belt and a dirt floor. But, you want to spend $80,000 on an advanced treadmill and all of these different systems and technologies. Right. You are doing that at your own expense. You don't have to do that. There's no expectation of that. It's just, this is why it's so dangerous to give the keys to the clinic to the therapist who just wants to be a therapist. You need the business owner. You need the person that understands the exchange of value to protect the therapist from himself and to protect the patient from herself. And everybody comes out a winner when you have an actual business person in charge of it.
Yep. All right. So we'll change topics a little bit, but I think this is a yes and, or this is another industry that's doing something in parallel that we should be copying, but we're not because we have a bleeding heart or we think we're too fancy, and we're not. And the company I think we should copy is Gold's Gym. So the mall in my town, which I remember opened when I was in high school, was like walking into like NASA's space station. It was insane. And now it looks exactly the same, except it's 30 years old, right? So of course, who comes in? Target jumps in, all the other little stores that used to be great are now, but Gold's Gym has taken over 2 floors of I think where Sears was. So like 2 department store floors. And I walked by the other day, and I'll describe the map for the podcast listeners. This is what I took a picture of this. This is what's hanging on, like, you know, they close the doors, pardon our dust while we renovate. And this is what they're putting in there. So this is like a Where's Waldo image. Just look at this layout. First of all, I see a logo I recognize in the top left. There is that Parisi Speed School. You guys have heard of Parisi Speed School before?
I don't think I have.
It's a company franchise. It's some guy named Parisi who's like, you want to be a high school athlete, you want to run track, you want to go to college, you want to be faster. It's a protocol. It's great. They make people faster. People love them, right? It's frozen. Have you ever heard of frozen ropes, or is that just a New York thing? That's a national thing, right? Frozen ropes is like, do you want to be great at baseball? We have baseball centers with batting cages and pitching and fielding. It's just It's protocol, right? No PTs on board though. Oh, it must be bad. No, they make people faster. So at this Gold's Gym, they're showing you what they're renovating. So they're putting in this long, it looks like 100-yard turf floor for Parisi Speed School. Top left-hand corner, Chiro and Nutrition. There's like a room. Notice how it says Chiro and Nutrition in parentheses future. They built the space knowing they can put someone in there because they're going to build the rest of the environment that's going to bring the right people, bring the right boys to the yard because their milkshake is better than yours. They have baseball. It looks like pitching lanes, 4 pitching lanes there, but it could easily be batting cages as well. 4 of them, turf floor right next to that speed school. Going around the horn, they now have something called Swing, which is, I looked it up. It's a, golf simulator. So they're putting in a couple $20,000 golf simulators right next to the indoor pickleball courts, right next to the cornhole, area, which is right next to the locker rooms, which is also next to the reception and shake bar. Yes, this is a Gold's Gym, so there's going to be a bunch of racks and back and arm section and leg section and a track and a cardio and a group exercise for Pilates and a cycling studio. But now you start to see the different things, right? We've got turf, we've got pickleball, we've got golf simulators. This seems confusing. There's all this stuff, Tony. It's almost like they don't know what they're doing, or they're just designing Disneyland for people who want to move. What do they want to move? I don't know. Lots of things. Golf on Tuesday, pickleball on Wednesday. What do I do when I'm leaving? I buy an $11 protein shake. And we could even touch on Mel. We could even now touch on Mel Robbins for a second because I got thoughts on that. But look, why wouldn't this isn't a PT clinic? These people are dumb. Except, isn't this a better PT clinic layout that I just described rather than a bunch of plinths and beige paint?
What's the monthly membership?
I'll look while you keep going. So,
we have a Planet Fitness that took over a big space in a mall that's just a completely dead mall. Same thing, like $10-20 for a Planet Fitness, maybe $100 for Gold's Gym. How are we still stuck? We're doing $100 a session. How are we stuck in this world? I don't know a single PT who doesn't look at that space and start drooling, thinking about how amazing it would be for us to own that. Yet I don't know a single PT that owns it. I know some are getting close. I know some are moving in that direction. Wow. But this has been a frustration for 25 years that I've been in business. How do we not have the budgets to do something like that?
Fear. The answer is fear.
Yeah.
Here's the memberships. I'll read it for Dave. Basic, silver, and gold. Of course, options. So basic, you pay an enrollment fee, and then basic is $19 a month. Silver is $25 a month. Gold is $30 a month. I got to be honest. If I'm doing 3 options, they're going to be vastly different, right? Why would you do between $20 and $30? I don't know. This is Gold's Gym. Maybe I won't doubt them, but it goes from 20 to 25 to 30. But what are you getting? So let me like, what are you taking away?
That's the thing. When you show the graphic of the layout of the whole entire space, this is probably just the gym part of the Gold Gym area that you showed. They don't get access to the pickleball or the baseball cages or the Parisi Speed School or any of that.
All right, so
those are separate.
The difference is basic gets you like the gym, like you said, but none of the cool pickleball, swing, golf simulator, all hydro massage recovery lounge, which I didn't even mention. So as soon as you go to the second level up, you get all that. And then the reason to get the platinum version is you also get use of, I live between Newburgh and Middletown, New York, and there's a Gold's Gym, and obviously they're owned by you get access to both of them, and the pool and the jacuzzi spa and the racquetball and the basketball court. So yeah, they understood. Increase scope just a little bit. Take the super dangly thing and be like, yeah, you can have that. You got to pay more. Why? I get more. The funny thing is people do this math, no problem. They're like, yeah, they're either going to buy it or they're not, but they're never offended by it. For some reason, they are at a PT clinic. Isn't that funny? You get the same thing. You're like, you can't believe you're charging someone more. You already paid for it. Give it to them for free. And I'm like, I paid for it. I'd like for it to pay itself off and then make money so I can buy cornflakes and food for my family. Is that not okay? Is that not okay is an honest question. And for some reason, the answer is it's not okay. You need to bleed. You need to hurt. I don't know.
So this is where the financial illiteracy, like we spend so much time patting ourselves on the back for how smart we are, but this is where the financial illiteracy comes back to bite us in the butt.
Yep.
Access to all of that stuff for $30, $40 a month is unreal.
Bananas. I was ready for $100.
It's unimaginable. And yet we still have people that are mad at corporations, mad at greedy capitalists, mad at all of this stuff. We wouldn't have the standard of living. We wouldn't have access to the resources. We wouldn't have any of the stuff we have if someone somewhere wasn't making a profit that they then reinvested back into the system to create this kind of resource scale opportunity. I mean, it blows my mind. And, as much as we talked earlier about inflation and Medicare paying us functionally less because of inflation, I don't want to just harp on how little our dollar is actually worth, because on the flip side, you've got access to something like that I know homeless people that are paying a Planet Fitness membership just to go take showers.
Yes.
It's cheaper than that wouldn't exist without the capitalism and the profits and, all of the stuff we have around it. And then, of course, access to ChatGPT, access to resources and technology that would otherwise be unavailable. Pricing every 2 weeks. I
guess I wasn't reading it right. Saying the pricing is every 2 weeks. That's a nice little flim flam. Every 2 weeks. So it's $40 a month, $50 a month, $60 a month. Still feels low and still feels wide.
That should be the cost per week, not every 2 weeks.
$60 a month. Yeah. I mean, I was at the JCC in the Upper West Side in Manhattan. Like that was 100 and something a person a month. But I did my research. I looked at Equinox and was like, I know what I'm buying there. I don't need lilac scented towels. Like I need some heavy stuff. But I also looked at like New York sports clubs. And for me, the difference was a pool. That was it. Because I was training for tries. And I was like, I need a pool. There was a pool at Equinox. But I needed to wear a banana hammock. It was banana hammock only. And I was like, listen, I'm comfortable, but I want to wear the Speedos to my knees. So I couldn't do it. But I understood what I was buying. And it was low, medium, high. And I'm sure the JCC knew that they were pricing themselves between Equinox and New York Sports Club. They understood that. We as a profession, I don't feel that we do. We're just like, well, I'm worth this. Well, we can talk about the bullying. I don't have the graphic, but somebody in a Facebook group, we won't say who. We can't say who because they posted anonymously that they were being bullied by an insurance company. And I get the essential gist of the conversation was, and feel free to jump in. UHC were they clawing back money, or someone didn't submit paperwork in a timely manner, and so we're taking our money back?
If I remember correctly, and I'm the one obviously shared the image, it was an out-of-network billing situation. I think they were requesting documentation. They were auditing the account, something along those lines. And, the end result was they were taking the money back. And it goes back to just how I remember as a young person thinking your perception is your reality, and hearing these things, I'm like, no, there's an actual reality. There's an actual truth. And so when I hear somebody say the word bullying, I tried to look up the definition. I try to understand it. I mean, as an adult in this world, like, no, you just made a mistake. You didn't understand the regulations. You didn't understand the agreement. Whether you're out of network or not, it doesn't matter. There's an expectation for payment. You document these things, you track these things, you deliver these things. If you don't do that, the insurance company does not pay you.
Wait, does the insurance company write this down somewhere and then make you sign it?
They have published policy.
Well, they explain it. That's what I'm saying. It's a contract. They wrote it down, and you read it, supposedly, and signed it. Sorry, it's not bullying anymore.
So I'm going to say for this case, out of network, they didn't sign a policy. They didn't sign a contract with the payer, but they did submit a claim saying we did this stuff in the expectation that we satisfied the expectation. Yeah. So I go back. I'm like, okay, I make the mistake. I pay the price for my mistake. It's not bullying me if you want to take back your money. But that language becomes so inflammatory. And of course, we're not going to get into it, but we see that across all of media everywhere. The language that people choose to use on both sides, it's not one side or the other, it's both. It's intentionally inflammatory language. It generates likes, it generates attention, it makes you feel good. But that is a very real threat to everything.
Progress. So bad news, they're taking their money back. Good news, it's $12. They're taking $12 back. That's the upside, right? Hey, all right. Well, they're taking their money back. It's $12. It wasn't worth the stamp and the envelope you were going to put in the mail for that. We've got a few minutes.
Real quick to fight that. What we do, and I hope every other practice does this, which is having patients on the front end sign paperwork that says something around this. That basically, so for the out-of-network insurance, and we have had some of the UHC fallbacks, and it happens, whether it's we didn't provide enough documentation or whatever. But we had it during 2020 or 2021. We had like a couple that was on UHC, and we didn't get paid for 6 months or 12 months. It was something crazy, and we did have them sign something where it said like, "Hey, we already had your card on file for your normal copay, deductible, whatever," and then at some point we're like, "Hey, we need to charge you like whatever it was, $250, $300, whatever per visit." And it was like a lot of visits. It was like thousands. I think it was like $8,000 total or something crazy. So we said, do you want to do a payment plan, or can we just, rip this card right now? Obviously so then all of a sudden, the patient helped leverage, like they were frustrated, but they were kind of like mad at us. But then I'm also like, hey, like this is United Healthcare, like
your insurance company.
We were totally clear and transparent. And the paperwork says if we're not paid within 6 months of each of these dates of service, you are on the hook for this dollar amount. And at the time it was like whatever, it was like $250 or something like that, or $300. So they were on the hook for all these visits. And then we said, hey, we're gonna start charging your card, for these visits starting like tomorrow, next, whatever. And then magically, one of the spouses, one of the patients, was our leverage inside of United Healthcare, and magically it got paid.
Ding ding.
Because they didn't, the patient didn't want to be on the hook for this full amount.
Yep.
And if anyone's watching or listening, like anytime that this stuff gets posted online of like, I'm getting bullied by the insurance, whatever, like either have this in your new client paperwork for patients to sign it up front so that you will always be made whole. You're always going to get paid somehow, either from the insurance or from the patient, or just opt out, just be self-pay, just stop taking the insurance, whatever. Like you have choices, but to screenshot stuff, like, and back then when this happened, I didn't go on social media and, tag Tony and screenshot like this, call back and say the insurance is bullying me. What come on, we have options. We navigated it. We got made whole. All is good. And I didn't talk bad about United Healthcare at all.
What?
Now I am, but back then when it happened, I wasn't.
Dave, before we got 6 minutes.
Hey, hold on. My new patient is pulling into the parking lot. I need to go do an eval. I'm going to share my parting thought. Today was a great episode. We shared a lot of, I think, inspiration. Like I saw so many opportunities in the Gold's Gym example and the other stuff that we're doing. I just think it goes back to we as physical therapists understand better than anyone. If we want something good, it takes a lot of hard work. It takes a lot of failure. It takes a lot of mistakes. But if you keep working on it, we can achieve great things. That's it. Like that is a function of what we do in the profession. I'll see you guys next time.
All right. Dave, before we wrap up, I did this for you. I'm not sure if are you able to see the screen? Like, can you look at the live stream? Because I have some images for you, or I can just describe them. It's a podcast anyway. So I got bored last night.
I'm watching. I'm watching right now.
I got bored last night, and every once in a while an idea hits me, and I was like, okay, let's do this. So I was like, how would I get more patients if I were Dave Kittle? And then I like cute little weird ways, like weird. So I came up with this idea, and I went to Canva and I mocked a bunch of them up. I'll send them to you, right? And I even branded it. I even used your logo. So
put them on the screen. So here it is right now if you want.
I think you should do door knockers like in hotels. I want the setup to be on side one, and I want the punchline. I want someone to return to their apartment in New York City and be like, "What the hell is this? This is supposed to be." It's juxtaposition. It does not belong. The do not disturb door hanger does not belong in a residential thing. It's a hotel thing. So automatically, intrigue achieved, right? So for the people who are just listening, it's a door knock campaign that I call Please Disturb, not Do Not Disturb, Please Disturb. So the front of the first one, says, imagine you came home and you were like, you got groceries in your hand, a bag, and you're getting your key in the door, and it says, there's a door hanger saying, this door leads to relief. And then like one of those turnover arrows. And then on the other side, the punchline says, your living room is our clinic, concierge pain relief. Phone number, call 24 hours, QR code. So it's setup, punchline. Setup, punchline. So here's another setup. This one is facing the consumer, right? So they come home and they're like, what? And it just says checkout time. What is this? And they grab it off their door and they turn it over and it says, for pain, your living room is our clinic, concierge pain relief. We come to you. QR code, phone number, 24 hours. The next one, this is not a hotel service. You turn it over, but we still come to your door. Concierge, pain relief, physical therapy, QR code, phone number, call 24 hours. Setup. What if pain was optional? Turn it over. Treatment at home, results that last. Concierge, pain relief. Phone number, 24 hours, QR code. I think I have one more. Oh, yeah. This door opens to...
I love these. I love this.
This door opens to better movement. What is that? So what is this? And you turn it over, and it says, we bring physical therapy to you. Concierge, pain relief. So you get the idea. It makes sense because it's the anti-digital ad, right? It's not digital. It's not trying to get into your feed. It's not doing those things.
In terms of legally doing this, I think there would be some residents that would get mad.
Sure. Get mad, or is it illegal? Is it? That's
the thing. I would have to check the legalities of this. I mean, because some people might probably not in their own building, but some people, if in certain buildings, but it depends on the building and the people. But
Agreed.
Some people might literally take it off the door and throw it on the floor, which would then now create trash for the people that work there. This is the assumption. You're making the assumption that myself or one of my therapists already have a patient in this building, right? Because we would have to have access to the building.
Right. Yeah. My strategy was like, so then I start to shoot holes. Like, why wouldn't this work? That could be one of them. I would want to know the legalities, obviously. Right. Second would be like, well, how are we going to deploy this? Number one, they're cheap to produce, but it's still on brand because a hotel sort of has this level of cachet, right? Do not disturb, right? So it still keeps your concierge level of brand. You didn't have to sync. This is actually bringing like fancy hotel quality to like my house. Like that's kind of cool. You can carry a lot of them. And yes, my idea was while you're treating Mrs. Smith on 5F, between you and the I'm not asking your therapist to hit every door, but it's like between here and the elevator, a couple. My next fleet of these would be playing off somehow, which was the bystander effect, which is like someone in your building is getting better right now. Why not you? Do you know what I mean? Like without saying who the neighbor is, I've been in the building. Right. Someone else is doing this. It's a reason there's a testimonial. Or, all right, we're live workshopping this. Do you offer a free session to Mr. Smith, the last session, if you're like, can we put your testimonial on a special run of these door hangers for this building? Listen, here's what we're going to do. With your permission, your last session is $0. If we can write exactly this, Mr. Smith said this, he's in 3B, ask him if it worked for him. Almost like when someone cuts your lawn or does siding on your house and they put the sign in your yard to be like, look what kind of work we could do. That would be a twist. Because who'd be like, yeah, okay, I don't care.
Yeah, so I've done some versions of this.
Okay.
Like in certain buildings, before you get to the elevator, there's like a little table,
yes,
and it's got like a little flower or a large bouquet of flowers in certain buildings,
yeah,
or like a mirror. There's something there, and I'll just drop like a couple business cards on it.
Yep. And
like sometimes over the years, like I've been a little aggressive. If there's like a spot in the elevator, I'll like slip my business card somewhere, like in the elevator, or if there's like a little 9x11 like
a cork board.
Like a little
plastic
frame
thing.
That's like talking about like upcoming events or something in the building.
Yeah, I don't want to. Hilton wouldn't do that. Hilton would do this. I want you there. That's great for John Q. Public PT because they're like, I'll just jam. That's what a real estate agent does. They jam their card wherever. I don't know what the ROI is on that. Like when I go to a coffee shop and I see like 47, like that makes sense for like handyman services. For you, I'd want to bougie it up.
Custom door hangers, is this what they're called? Doorknob hangers? Door hangers?
Door hangers, yeah. I could send you the file through Canva. You can buy them through Canva without having to take the artwork out now. Canva lets you print like Vistaprint or whatever those things are. You can just hit print and then 100 or 500 or 1,000.
Send it to me.
Yeah,
I like it.
But now you can just play with it. And I got this idea because I had a woman do she's like house cleaning, and she cleaned my house 2 months ago because I didn't seek her out. A friend sent her to me, and she was like, I'll do it for free once. And I'm like, well, I'm not an idiot. So I happened to be sitting here and I was talking to her, and I was like, how do you find new clients? And she's like, well, Facebook groups, but like word of mouth. And I had this idea for her. I was like, so I designed a whole fleet of these for her. I'm like, so your advertising cost is a tank of gas and printing. And then you drive around and you put them on a bunch of people's doors while they're at work. So when they come home, it's like, wouldn't it be great if, and then flip it over, you stepped into a clean home, ray of sunshine, house cleaning. And I'm like, that's cute. Because even if you batted 3 out of 100, that's because like house cleaning is hopefully recurring. Like you get someone you like, and trust, and then you keep that person. And then you offer them deals. Like it's $300 for me to clean your house unless you guarantee, unless you sign up for 12 months, and then it's, $200. Like you give them a crazy deal. And then I was explaining cash flow to her. I'm like, now you get them to sign up, not just agree to it. You got to pay up front. So that's where the door hanger thing. I don't know. I'll send you the file. It'd be cool to do different QR codes on different cards to see which funny one-liners worked best. Because if you know what I mean, like to see which ones of the jokes landed. I don't know. And then where they came from. All right, parting shots, Dave. What do you got?
Oh man, we covered an array of topics, but in terms of the big one about ChatGPT and health, the more models like that, the more tools and resources, the better with empowering folks around their health and wellness. I don't think there's any disagreement there. Will it result in more consumers becoming a little more savvy about their health and wellness and understanding what are their options? I think yes. I think that's, like I said, a net positive. I think that could be totally a great thing. Could it help or result in some patients or clients going the route of conservative care and physical therapy at the same time? I think so too. I think more of we talked about it before with video and YouTube and Instagram and Facebook and TikTok and more video helping physical therapy and everything, acupuncture, chiropractic, everything in the health and wellness world. So will this do the same? I think it can. Don't
be Metallica. Here's what I mean. Metallica should have been the poster child for like, screw the machine, man. Screw the man. The man's keeping us down. But when Napster came out, which for the younger part of the audience was a free file sharing service that you just go onto this app and you could download any song.
They were hardcore against it.
Hardcore against it. Like they were like testifying in Congress. And listen, I get it. Except you're never going to legislate. You can't rage against the machine. The machine being a bunch of people in government. That's what rage against the machine meant. It didn't mean rage against the computer. The computer wasn't the machine. You get a lot of shovels and a lot of brooms, get everybody you've ever met and meet me down at the beach. The tide's still going to win. We can shovel that water out as fast as we want. Tide's still going to tide. Technology is tide. You either learn to float and navigate or you get run over and drown. The tide is coming. It does not require you to believe in it for it to come. So you either get with it or you get run over by it. We'll see you guys on Tuesday. For anybody in New Jersey, I'll see you at Kane University with APTA New Jersey's Student Conclave. I'm actually not sure why in 2026 we still call student events the same thing we call an event when we name a pope. I'm not sure why we're still calling things conclaves, but hey, I'm gonna be at a conclave. I'll see you guys out there. I'll see you on Tuesday, Dave.
That's it for this one, but we're just getting warmed up. Smash follow, send it to a friend, or crank up the next episode. Want to go deeper? Hit us at ptpintcast.com or find us on YouTube and socials at ptpintcast. And legally, none of this was advice. It's for entertainment purposes only. See, Keith, we read the script. Happy now?